So the final speaker in this session is Professor Roderick from the University of Geneva, and he's going to help us draw some of the threads together before we get into the final session after afternoon tea. So over to Roderick. Thanks very much.
Well, good afternoon, everybody. I'd like to thank the organisers for giving me the opportunity to present, and I will not be presenting the paper as shown in the abstract of the conference program. You've received a written version of my paper presentation in World Health Design, and instead I'd like to try and bring together some of the key points that I think have been addressed during the last 3 days. And I think we've seen a range of topics related to my original article on nature-based designs for health, which go from the building to the site to the district and the city scale. And I would like to move on from there and consider some of the key issues that we could be looking at in order to co-produce the future we want. And I'm specifically using that term related to the presentations on the first day relating the issues around this conference to the Sustainable Development Goals and the post-2015 agenda. My presentation will look specifically at urban health, which we've been dealing with, and this idea of it becoming a planetary concern. And then I'd like to develop some of the points just presented by Professor Yeo about the human ecology perspective. It's the perspective I use in my work that I've been teaching through my career. And from there, building on to transdisciplinary inquiry. And I think we've had some extremely interesting examples of not just interdisciplinary research, but transdisciplinary contributions during this conference. And I want to talk about the added value of transdisciplinary inquiry based on my experience with the Swiss Academy of Sciences during the last 15 years. Based on the presentations and posters that we've seen, I think we can say there's a couple of core messages. The first is that multiple factors are influencing the population of health in urban neighbourhoods, and it's extremely important to understand the multiplicity of the factors involved. We've heard a lot about the environment, we've heard a little bit about the economic dimensions, we've heard about cultural differences, socioeconomic status, technological input, and the whole question about access to medical and health services. But also we talked about the question of information, informing the public, making the public aware. And we've got this incredible case of lead in water supply pipes in Hong Kong at the moment, which is an important example of the everyday experience of people and them being informed about their health challenges. But what's been extremely important here has been the contribution of people from Hong Kong in the housing, building and planning sector. And I just wanted to remind you that we've seen that it's really important that although we're talking about urban health as a planetary concern, we must take it down to the local level of the neighbourhood or the district and the building block. We know that there are significant differences between health within cities and that these, in fact, are increasing. They're not decreasing. And that's a major challenge for Sustainable Development Goals in the 21st century. The second point is complexity. We've come to understand that design and health are not simple, that this is a tandem that requires a certain humbleness on our part, and that the beacons for change that we've seen here have developed from commitment, from teamwork, from communities of practice, which are extremely important. The third point is the context-specific character of urban health. We've heard quite a lot about the context-specific nature of design and hospital design in particular. But I think it's really important that the context-specific nature of health challenges, and we've just learnt about Vietnam, we've heard about Hong Kong, we've heard about many other places, and I think one of the enriching parts of this program has been the cultural diversity of contributions. And these come down to lifestyle, the points that Professor Yeo were making, and that are extremely important in understanding the way we can move forward. Now, one of the ways that we move forward, I think, is shifting from international health to global health to ecological public health. And ecological public health has come onto the agenda at the international level, and it's moving beyond international and global health, I think, and it's really concerned about how the condition of the planet as a whole, how conditions within specific cities, which are not detached from the planet and global challenges, influence our health and quality of life. And I can recommend the reference here. Now, how do we apply this ecological public health, which is a synthesis of the main approaches to public health since the 19th century? Well, it was very interesting that Professor Yeo talked about human ecology, and here I've taken a diagram from my colleagues at the University of Bristol and enlarged the Dahlgren and Whitehead model that Professor Yeo presented, and showing that the human ecology perspective takes us from the centre, a people-orientated approach about health and quality of life, looking at their lifestyle and moving out to the community level, the local economy level, to the built environment, the natural environment in which every city is inscribed, and to global concerns about change with biodiversity loss, with climate change, and other microeconomic factors. And this is the perspective that I use in my teaching, that I've used in my transdisciplinary research involving design and health. Now, human ecology was invented back in the 1920s in Chicago, which was the first city with a skyscraper in the world. But it was applied here in Hong Kong, as Tony Capon said on day one, through the remarkable study by Stephen Boyden and his colleagues from the University, the Australian National University. And I've put the reference up here for you because it's a little known study which traces the development of Hong Kong from British colonisation in 1841 through to the 1970s. This was a program that was funded by UNESCO in the Man and Biosphere program in the 1970s. And my proposition to people from Hong Kong in the room is that let's try and get our act together and have a follow-up study 50 years later to see how this incredible metabolism has evolved and what have been the impacts on health and quality of life. Now, when we take the broader perspective from human ecology, and we need to move beyond this relationship between design and health. We need to move beyond the relationship between the environment and health. And if we take the example of public green spaces, we must use this concept of co-benefits, which WHO headquarters in Geneva has endorsed, and talk about the relationship between public green spaces and health by looking at the co-benefits from a biological, economic, environmental, health, and social impact assessment. And I think this is really important because we need to convince the policy decision makers that it's not just about health. We haven't been successful in getting our message across with health, so that we need multiple arguments to look at the added value from this range of perspectives, and that we can use then the beacons for change that we've seen during this conference to mainstream them into urban planning and design in the 21st century. Having said that, if we want to go beyond the simple correlations and have the broader human ecology perspective, we need teamwork in order to apply this broader perspective. We need the contribution of scientific research, which we heard about during this conference. We need the important contribution from professional practitioners. We need the investors and the developers on board. We need the general public to be well informed. And that's why we need to go beyond disciplinary confinement to multidisciplinary, beyond multidisciplinary collaboration to interdisciplinary and transdisciplinary contributions. We're talking about the science policy interface. We're talking about our contribution to the society we want in the 21st century. And this was an important issue that was put up in the question and answer session in the first session of our conference. And I'm coming back to it because it suggests that we can move forward in significant ways. Interdisciplinarity and transdisciplinarity are buzzwords. And they've been used interchangeably by many, but at the Swiss Academy of Sciences, we make clear distinctions between multidisciplinarity, interdisciplinarity, and transdisciplinarity. And this was already clearly established in 2004 in a special issue of Futures, which I guest edited. And the diagram from my colleague Thierry Ramadier shows here that on the left, we're shifting from the disciplinary silo on the left of the diagram, in which each discipline has its own definition of health, of environment, of value, to multidisciplinary contributions, which are simply the juxtaposition of contributions from different professions and disciplines. And environmental impact assessment is a very good example of multidisciplinary approaches that is commonly used today. And interdisciplinarity involves a willingness to collaborate, a willingness to exchange, to communicate, to integrate and take on board the points of views of others. Now, these three terms are used in scientific modes of knowledge production. And transdisciplinarity challenges the fact that when we're dealing with societal problems like designing for health in the 21st century, we need more than scientific or academic knowledge. We have to bring in professional experience, we have to bring in professional know-how, and we have to account for the lifestyle and the points of view of the local populations. And we've seen very good examples of that during these 3 days. And I'm saying that we need to make these mainstream because there is an added value here. And this was pointed out by Jean Piaget, the famous developmental psychologist in the 1960s, when he made the distinction quite nicely, and I've simply reproduced his diagram, showing the multidisciplinary approach on the top diagram and the interdisciplinary approach below, with collaboration, interaction, and coordination at a superior level, which gives you a more in-depth and enriched understanding of the complexity of the issues that we've been dealing with during these last 3 days. And one way of actually doing this is by cognitive mapping, which was mentioned also by Tony Capon on the first day. This is an example from the Royal Commission of Environmental Pollution of the United Kingdom, which shows that when people from transport, from environment, from health, and from energy, who normally are working in silos, come together and try to consider the web of connections between increased car ownership and use at the top of the diagram, health impacts, environmental impacts, land use changes, risks to the economy and to the quality of life of the populations. We are building bridges across the disciplines and the professions we are working with. This kind of approach has been used very successfully in the Swiss National Environmental Health Action Plan, which involved land use, agriculture, housing, environment, and transport. And so one sees that there is a shared concern about building a better future by the collaboration. And this is the way we can break the ice to do that. So in order to produce the future we want, we need transdisciplinary contributions. And this is an interesting diagram published 2 years ago, which says that if we're shifting from multidisciplinary and interdisciplinary collaboration to transdisciplinary inquiry, as we've seen in this room, with some very interesting examples, such as Mark Johnson's work in the neighbourhood of Bronx, or the work we saw with the hospital in Vienna just before the lunch break, we have to develop a common vision. And we see that this common vision is not just involving architects and people from health. We've got to bring in the funders, we need to bring in the researchers, we need to bring in the business sector, and we need to bring in policy decision makers. We're building consensus. We're developing negotiation skills. And we're talking about shifting from individual choices to the public good. We're integrating all of the knowledge that is available. We're not starting from scratch. We're not reinventing the wheel. And then we're implementing together. Now, some have called this transdisciplinarity. Some have called it co-production. And that's the term that's commonly used in the UK today. But we can also talk about team science, communities of practice, civic science. These are all moving in the same direction. We're talking about co-design, co-production, co-implementation, and hopefully co-monitoring to show that we've got added value. Good examples of this include the PEP, the European Charter on Transport, Environment and Health, which has had extremely important implications in European cities, throwing out motor cars, bringing back in cycle pathways and public transport systems. Just before concluding, I want to make an important point. I think that we must remember that when we're talking about urban planning and design, there are two basic histories. The one is remedial and corrective measures, and the other is idealism and utopian visions. We've had a strong focus on idealism, utopian visions, and the construction of new building. We've had less concern about requalifying, retrofitting, and so forth, but we did see examples, and we must remember that the city of the 21st century will not be starting from scratch. So if we want to co-produce the future we want, I'm suggesting that we need to rethink our contribution. We can think creatively. That is the capacity, the unique capacity of the human brain. And I'm suggesting that we can make examples of good practice in order to develop the future we want. Thank you for your attention.